Been bringing you throughout the entire night. The phone lines, they remain open, and they remain open for business. Our team of experts at LECOM are answering your questions on the vaccine. How big, how small, it does not matter. They want to make sure that you have the information that you need. Phone lines open until 7 o'clock, so you've got about 50 minutes left to go. The phone number to dial is 814-454-5201. The extension is 1. It's as simple as that. Just call that number, dial 1, and you'll have your question answered by one of our experts. Speaking of experts, our final panelist of the night, running all the way from the question and answer call room to the alert desk, is Dr. Becky Dawson, epidemiologist, exclusive Erie News Now contributor, and a professor at Allegheny College. Doctor, I know it's been a busy day, and let's just start with this. The questions that people are asking, what are the trends?
So I think a lot of the people who are calling are people who don't have access to the internet, are not comfortable making appointments, or can't figure out the systems that are in place in order to get a vaccination. So there was a lot of people who wanted phone numbers, who wanted that personal connection and kind of that, hey, how do I get it? Who do I talk to in order to get the vaccine? So that was really kind of, those nice moments of connecting with people. I think there's a lot of people that still want to be sure that they qualify, that they're in 1A, that they should be getting the vaccine right now. And then all of those, individual questions. I have this, I'm on this drug, this is my situation. Can I get the vaccine today? Am I eligible? So there was a lot of good questions about safety, but also kind of how do I access the system and get those appointments.
And the phones have been ringing off the hook, as we've been seeing from our live system. So again, keep calling in. Let's start with the big question about information. We've been talking at length about the need for hospitals around our region to be able to have that contact info. And the state put out guidance just a short while ago about you need to have this, you need to have that. And we saw hospitals kind of adapt. How important in your mind was that guidance to be able to implement to the hospitals to say, listen, you have to have this?
It's imperative. So I think it was important across the state of Pennsylvania, but especially here in the Northwest where we do have an older population. We do know that a lot of people don't have access to the internet, either because they don't use it, or we have people that are rural enough that really don't have access to the internet. Like they can't get it at their geographic location of their house. So being able to call and talk to a person and schedule an appointment is really important, especially given kind of our demographics and who our community is. So I think it's vital that we actually will get people registered who should get the vaccine.
Of course, right now in phase 1A, and that has been the case for the last couple of weeks here as we continue the vaccine process. Doctor, let's get into questions in just a second, but you brought up rural areas. I was going to wait till a little bit later, but we'll just hit this now. The county executive on Sunday in the mass vaccine clinic at AHN St. Vincent was talking about the fact that she would like the vaccine to start being pushed out, or at least effectiveness and distribution to rural areas. I'm wondering how that happens, because we've heard from hospitals we only have enough doses to vaccinate people that are, most in need, but we only have as much as we can give. How do we push the vaccine out to rural areas without lessening the vaccines that are in the hospitals themselves?
Right. So, supply is going to be the most important. But I think that we also, and I think the county executive was kind of getting at this, that we need to get to the rural areas. It shouldn't just be, I live close enough to the convention center and I have a car and I can make an appointment, and that makes me more eligible than somebody else who's in that high risk area as well. So I think we do need to think about people who are don't have the type of advantages that you might have being closer in, that when you're rural, you might need a vaccine clinic to come to you, or you might need, it to be closer to your home. So I think that it's really important, because we do need to get everyone vaccinated. We're only as strong as our weakest link. So if we ignore a group of people, it's not going to help end the pandemic. What
does that distribution model look like? Is it mobile units? Is it making sure that rural areas have a center that they can go to? What's the easiest route, path of least resistance to be able to go about that?
So I don't think there's one great path. I've seen amazing models. So I've seen the mobile clinic go and set up somewhere. So whether it be at a church in a rural area or a school in a rural area, someplace that people can easily get to. We have seen the mobile vans go to people's houses. I've also heard of really creative solutions about sending your vaccinators with Meals on Wheels deliverers, people that are making, home health clinics already, to kind of take advantage of some of those routes to some of the people that would be eligible in 1A.
And so the last question then is, if we can't get the vaccine out to rural areas because of the supply and demand issue, Is there anything in the interim that we can do to make sure that people are at least informed, letting know of, hey, this is when I can go to get my vaccine?
So I think what we're doing today is really important. Honestly, the phones are ringing off the hook, and everyone that I talked to said, I'm struggling with the online part, or I don't have the internet, or I want to register and it's saying I have to have an email address. And some of us don't have those in our community. And so I think that what we're doing now and what the hospitals are starting to doing and the health agency is starting to do is really important so that we can have that personal one-on-one like conversation and help people not just get their appointments, but get the education that they need to start, thinking about or preparing for their vaccination.
Because there is a lot to prepare for and educate yourself on. As we've been seeing, I myself have been educated more so than I think a lot of people in this process. Doctor, let's get into the questions, shall we? We'll start with Britt. Simple question for Britt. Do the vaccines have MCR5 in them? MRC5, rather.
No, I don't believe so. But you can go online to both Pfizer and Moderna, and you can look. They have all the ingredients that are there. There are no preservatives in these vaccines, which is why they have such a...
Anticipate that changing in the near future, especially with all the chaos and confusion and concern of people?
I hope so. I think this has been a really hard time when and I've been preaching all along, like, this is a community health issue. This is, your health impacts my health. And now we're all fighting to get in line for the vaccine, myself included. I've been trying very hard to get my parents registered. So I think that what we need to be thinking about right now is, yes, we need to get the vaccine and we should be advocating for ourselves, but also cheering, helping, assisting other people, because the vaccine is helpful to us individually, but I think what we want is a healthy community, and we all need to get vaccinated for that to happen.
Talking with Dr. Becky Dawson, a professor at Allegheny College, epidemiologist, Erie News Now contributor, more titles, but I don't want to take the time to name them all because we have so many questions to get to. Let's go back to Britt. Britt has a follow-up question here. She's wondering, just as a logistical perspective, why should we trust the vaccine now when it took under a year to create it, and health risks, she says, seem far greater than a virus that has a 97% survival rate?
So there's a couple of things. Number one, yes, it was developed fast, but that's because it built on technology that we've been working on in virology and vaccinology for decades. So mRNA vaccines have been conceived in the late 90s. We've been trialing them. And we had the advantage because the SARS-CoV virus, like the original SARS virus, is genetically very similar to the SARS-CoV-2 virus. They even kind of share all their names. So we had a head start, right? We were out of the gates running fast. And I'm not going to lie, the infusion of money from the federal government to make this happen, to support the pharmaceutical companies, has been a huge boost. It's incentivized them. It's helped them develop things quickly. So it hasn't been rushed. We've actually built on technology, and there was a lot of money to help make this happen fast.
As a curiosity for someone who's not in virology and for people who might be wondering, how does mRNA make a vaccine develop quicker than normal? What's behind that technology?
So mRNA is the little piece of the genetic code, and we actually pull it right from the SARS-CoV-2 virus. And it is the code that when it's in your body, it stimulates that spike protein, right? And the spike protein is what grabs onto your proteins in your body, and it attaches, allows for replication. So what it does is when it gets into your body, the vaccine gets into your body, it actually makes the spike protein without making you sick, and it allows your body to develop an immune response.
It's amazing what technology
It's
can
amazing. It's super exciting.
I'll tell you, it's not just with a TV station. It's not just with your iPad. It is with coming up with vaccines, too. We've seen that across the board. All right, let's go to Elizabeth here. Elizabeth wants to know if you are getting weekly allergy shots. Can you also get a vaccine? And if so, how long before and after the vaccine can you resume your allergy shots?
So if you are getting allergy shots, I think you can get the vaccine, so you're not on the list of individuals that shouldn't get the vaccine. They are asking people, like, if you're getting other immunizations, to wait 14 days, so like a 2-week grace period. But this is something you definitely, if you're getting weekly shots, you should be talking to your provider about what you're allergic to, what your reactions might be, when should you get the shot, how do you time it with your allergy shots. Those are important questions for that one-on-one primary care provider allergy shot administer.
I'm glad that question was asked, because I have the same scenario, because I get allergy shots too. So thank you for asking and thank you for answering. So now I know if I'm able to get the vaccine soon. Let's go to Mandy here. Mandy's curious, is there any effect on people that have had Botox when they get the vaccine?
Not that I know of. I haven't seen anything. CDC did just release all their vaccine, all of the adverse effects reactions. So really looking at everyone who got the vaccine in December and early January. And there's been very few side effects given that, basically it was the healthcare workforce that got the vaccine. So I haven't heard anything, and I would definitely go get my vaccine even if I was getting Botox shots.
Okay. Let's go to Kay here. Kay has a question, and I'm sure there's going to be a lot of branches off of this, so we'll start with the answer and then we'll go from there. Do you have to wear a mask after being vaccinated?
Yes, you have to wear a mask after you've been vaccinated right now. It's possible that will change, but there's a lot of factors that will impact it. One, how many people have immunity, how many people have been vaccinated, but then we also have to take considerations about the new variants, how the vaccines are responding to those variants, and I think also equity issues. It's great that you've been vaccinated, but how do you prove that? How do we can't go around policing people, so we all need to continue to wear our masks.
And you talked about there are a lot of factors that would have to change that. Herd immunity, I think, is probably one of the greatest ones. What does herd immunity, whether it's a number or whether it's a scope, what does that look like?
Herd immunity means that as a community, as a population, we've actually created so much individual immunity that we combine to have population level immunity. And to be really honest, I think we might be seeing, some impacts of increasing immunity in our communities, but we're a long way away from the virus actually not transmitting, not passing from person to person in our communities because of herd immunity. That's a lofty goal. We're talking, maybe 85-90% of the population having immunity at one moment in time of the whole population.
Do you have a timetable of when that could happen?
No, that's a long way off in my mind. I think that we have a long way to go, which is why we're hearing you got to wear your mask. This is going to be the case in 2022 because we still are going to have a lot of community spread until that point. It's going to take a while.
Okay, well, we'll see. Again, the timetable, it's obviously difficult news. And again, it's an interesting question because, right, you think the vaccine immunity. And I guess that brings me to another question, too, is there are grandparents, parents, children that are calling and saying, well, my grandparents and my parents have been vaccinated, but I haven't. Or as a grandparent, I've been vaccinated, but my grandchildren haven't. If you're a family dynamic and there are people who have been vaccinated but others who haven't, is it still unsafe to go see a family? Is it safe? I mean, what would be your recommendation?
So again, I think just speaking generally, if if grandparents have been staying away from their grandchildren and now they're both vaccinated, so have both shots, or 14 days post-vaccination, their risks, the grandparents' risk, has decreased significantly, right? Mm-hmm. They're going to have immunity. If they're exposed, they're likely not going to see the health effects of COVID-19. So again, I think that, that's where you start making decisions. Is there somebody else in the family who's high risk? Is this, good for your mental health? Do you need to check in with one another? Do you need that, that hug or that, dinner together, or whatever it is, because it's been a really long year. So I think that the vaccine, again, we don't want to open everything wide up, but at the same time, I think that we do need to start thinking about our mental health and some of the advantages that the vaccine gives us.
Yeah, and of course, seeing family, one of those biggest adhesives, if you will, to bandaging mental health.
Yeah.
As we look back in our call center, mental health could be aided too by making a call to our call center tonight because you have a bunch of questions. Dr. Dawson knows that firsthand. The number to call again, 814-454-5201. You have about a half hour plus left to go, so still plenty of time. Call in. We have plenty of experts from LECOM until 7 p.m. Make sure to make that call, and we'll get your question answered for you, whether it's here or whether it is over the phone, as Dr. Dawson was mentioning. Back to the questions we go. It's a question that we kind of addressed a little bit earlier, but Bruce is asking, so we'll talk about it here. Bruce lives in Corey. He's 74. He's wondering if he'll have to go all the way up to Erie to get his shot, or if Erie is planning on bringing them to Corey at some point.
So I don't know if Erie's planning to bring them to Corey. There are lots of places, though. So with the federal pharmaceutical program, kind of opening up local pharmacy chains. So I don't know. I've never been to Corey, so I apologize. But CVS's and Walgreens should be getting the shot here soon. I know that Giant Eagles have had the shot in very limited capacity. I know that Warren General Hospital has the vaccine as well. So I think that we're starting to see kind of an expansion of who has the vaccine and where they're offering those clinics. So You might not have to come to Erie, but it might not also be, kind of brought to your community. And we're going to have to think through those because it's hard when you have a small community that doesn't have like a healthcare center or a hospital.
Answering your questions tonight, Dr. Becky Dawson, epidemiologist, Erie News Now contributor, professor at Allegheny College, which is near Meadville. And it brings me to my next question. You are going to be an expert on this.
We'll see.
It comes from Mandy. Mandy's wondering, should the people who are about to receive the second dose in Meadville that were canceled be worried they won't get their second dose? This is a big thing with the Meadville Medical Center right now, and
Right.
I'm wondering if you can comment on that.
Right. So I think we're not at the place where we need to worry. We're not even a week out since those shots were canceled, and we have a 42-day window. That's 6 weeks. So I think there is no one at the Meadville Medical Center who doesn't want to give people their second shots, right? I mean, it is to their advantage, both from a public health perspective, but also from just a vaccine distribution, being able to report back that they've fully vaccinated people to get them the shot. So really it is about supply right now and getting the supply of those second doses. It's not that they're individual, like the stuff in the containers, the vials are not different, but they are denoted first dose and second dose. That's how the system is kind of keeping track of them by how they're labeled on the front. So I don't think we're at the point where we should be worried. And I know that Meadville has about 2,000, from what I've been reading, people that are waiting for those second doses. But we have 3 more weeks. So I think patience is going to be of the utmost importance right now.
Was there anything that led to the cancellation of the second doses? Was it just an overflux of first doses distributed? Was it a miscount? I mean, what led to it?
From everything we've heard, it was because of the snowstorm, that the blizzard and the Arctic freeze through the Midwest, prevented the vaccine from getting out. And I think this is just that reminder that you can't just stick these in the back of a U-Haul truck, right? They need to have those deep freezers, and they need to be, backed up and made sure, and that the proper conditions have been met. So it's not easy transporting these things, and the winter storm really kind of threw a wrench in transportation.
It's interesting you mentioned that, because the Biden administration had held multiple press conferences at the end of last week talking about we're trying to get back on track from the snowstorm, the cold, the winter, and like you said, you can't put them on the back of a U-Haul. They have to be in those, especially the Pfizer vaccine, making sure they're in well under sub-zero temperatures and in a very contained place, which I'm sure is not easy when transporting them.
They're also glass. I mean, like just having a moment to remember, we're moving tiny glass particles that need to be kept really, really cold. And, whether it's a train, a plane, a bus, you need to have backup generators. You don't want something to fail. So it's not like there are a ton of vehicles that can move these vaccines around easily. It takes a lot of coordination.
All right, let's go ahead and see if we can get to more questions here. My goodness. None that I can see right now. So let's continue to go ahead and chat about the vaccine here. We were just talking about the distribution and the fact that Pfizer vaccines, Moderna vaccines have to be kept at sub-zero extreme temperatures. The Johnson & Johnson vaccine may not have to be that. And I'm wondering, we talked a little bit about the effectiveness and how important it could be in distribution, but just in terms of transporting it, do you anticipate the Johnson & Johnson vaccine being able to be transported in higher amounts quicker because of its non-need to be stored in those temperatures?
Yeah, I think the Johnson & Johnson vaccine has a ton of advantages, both in terms of transportation, but also, the technology that the Johnson & Johnson vaccine uses is different than Moderna and Pfizer. So it actually is not using the RNA, it's using the DNA of the virus. So it's still not a live virus vaccine. It's a genetic vaccine, but it has a little bit more durability. It's a little bit more robust in those containers in terms of travel and everything. And then just from even a labeling standpoint, Pfizer and Moderna are first dose, second dose. We're trying to keep track and follow up with people. This is a 1-dose vaccine. So just logistics. I feel like we can all sit down and breathe a sigh of relief. I think there's so much excitement about Friday.
Now, what makes it a single-dose vaccine?
It really is the technology. Okay. So the way that they developed it, the type of technology that they've used has really made it so that you only need 1 dose. They're looking at different dosing schedules, what that might do. I mean, there's lots of questions, but it really seems to be both safe and effective with just 1 dose.
Now, there's a lot of concern from people, though you say that Pfizer and Moderna's 2 doses, you need 1 for Johnson & Johnson. That could possibly mean that it's not as effective. I mean, what's the efficacy tested trial that you've seen with Johnson & Johnson?
So Johnson & Johnson has put out that it's about, somewhere in the 70s. So effectiveness is around in the 70s. But I think it's really, there's so much context here. So Johnson & Johnson completed its phase 3 clinical trial, which all the data will be available tomorrow online. So it's an exciting day, but they did all of it while these new variants were developing. These new variants that seem to be causing a lot of problems in terms of transmission and hospitalization, potentially death. And the fact that they're seeing, even in South Africa, where that strain that's causing a lot of us to lose sleep at night, is they're still seeing that it's preventing 50% of deaths, 50% of hospitalizations. And I think we need to count that as a success right now. We're not looking for perfection. We're looking for progress. We want this to end, right? We're not looking for a perfect scenario.
And the Johnson & Johnson vaccine you anticipate could possibly be approved on Friday.
Yes, the EUA vote is Friday afternoon. So you can watch it live online. I'll be set up at home, so I'm really excited. It's so much fun to see data and all of this clinical trial work then go through the policy process to make a vaccine available to all of us in an emergency situation. So it is for some of us like a Super Bowl, but I think the vote will be late on Friday afternoon after they do public hearings. They hear from Johnson & Johnson. They hear from the people at FDA that kind of watched and observed and made sure the clinical trial happened properly, and then they'll vote to determine whether the emergency use authorization is granted.
So let's say the vote goes through and it's approved on Friday. What's the timetable for that? Set the time from when it gets approved to when it's in the arms of Erie's.
So if it's anything like Pfizer and Moderna, it will be next week, right? We had it happened so quickly the last time the vaccine kind of rolled up. So, it could be mid-March that it's here in Erie, which, again, more vaccine, one dose. I mean, just so much excitement.
And so if it is next week, talk about getting a boost for hospitals. That would be certainly good news for hospitals in the area. Talking again with Dr. Becky Dawson, epidemiologist and an exclusive Erie News Now contributor. Here's the phone bank. We got our assistant news director, Adam Snow, on the shot. There you go. He's gone now. There you see the people on the phone calls right now. You have 28 minutes to be able to call in right now until 7 o'clock. Number to dial is 814-454-5201, extension 1. A lot of phone calls coming in. Dr. Dawson saying the phone's ringing off the hook. So still a lot of time left for you to ask those questions. All right, so when it comes to mass vaccination sites, we know AHN did theirs at Erie Insurance Arena. We know, LECOM with the Bayfront Convention Center. We know the supply has to outweigh the demand, but I mean, is there any other way that a mass site could possibly be instituted, even if the same number of doses are coming into play here?
Right. So I think it depends on who gets those doses, how long they have to distribute them. I think there is, the concern of, will we get the same number of doses next week? Can we fill all the appointment slots? I know that a lot of these clinics are asking people, within 24 hours, make your appointment, show up. So I think that, the logistics are pretty tricky, but we have plans in place. As I said, the counties have plans to do huge mass vaccinations at fairgrounds. I know that wouldn't be pleasant right now given the weather, but drive through maybe. But I think that there's a lot of potential to do these things. We just need the supply here. So
you talked about the potential for the fairgrounds. Are there other big locations that, from what you've heard, that could possibly be on the list?
Yeah, churches, schools. I mean, big, type of spaces. I know the Meadville Medical Center is using a big Catholic church that has just literally opened up their basement to, let the vaccination clinic happen. So yeah. I think there's a lot of potential, and I think that there's a lot of community cooperation to, get people in and, get the shot into their arms. So it's kind of fun to watch the community come together in this moment, but we just need more vaccine.
That's the four words.
Exactly.
Demand still outweighs supply. If you have any question, that's really what the answer is at this point. You talked about schools. You mentioned schools could be possibly, and school is teachers. Teachers have been a big center point of debate in these last couple of weeks. Should they be moved to Phase 1A? Should they be given precedent? We've already seen Phase 1A expand significantly. Now we have between 18 and 64-year-olds who have the ability, provided they have a comorbid condition. Do you anticipate teachers other groups being thrown into 1A? And if so, I mean, what does that do for the dynamic of the distribution?
I mean, I don't have a crystal ball to say. I think right now we're probably I think things are pretty set as we go through. And I think that it's not just about getting teachers into the next group. Really what it's about is building the system from delivery of the vaccine, the supply, to how do we get people registered? How do we get them to their appointments? How do we get them, like, consented into the vaccination process, and how do we follow up with them so they get their second shot? So it's this huge process that needs to really be ironed out and made seamless. And so really, I don't know if it's about moving teachers to 1A. I mean, I think personally I'd love to see that. But I think if we could get the process ironed out and it became clear and we could move through more people faster, teachers would be next, regardless of whether they're in 1A or 1B. I think the process needs some smoothing out, but it really starts with the supply.
And when it comes to schools and the vaccine, I mean, I'm not necessarily interested in looking for an opinion, but on a data level, statistical level, there have been arguments back and forth. Should schools be fully reopened? Should they not? I mean, does the data support schools to be fully reopened at this point if teachers don't have the vaccine?
Yeah, so we've seen, it's actually been understudied. I'm still a little surprised about this, but we've seen from the data that's available that actually there's very little transmission in schools, assuming schools are doing what they've been asked to do, requiring masks, enforcing masks, trying to make sure that people are kept 6 feet apart. We actually aren't seeing it in the classrooms, but we have seen transmission, obviously, with sports teams. School buses have been a real problem, right? I mean, the bus driver cannot be policing the kids in the back of the car, in the back of the bus, while they're trying to drive. I mean, that they have a safety responsibility first. So we've seen it there. Obviously, lunchtime can be a very easy place because you take off your mask. Every middle schooler knows that if you take off your mask and eat slower, you get more mask-free time during the day. I mean, kids are smart, but we've really seen very little transmission in the classroom. So that's encouraging, but it doesn't mean that there aren't other places that disease can be spread in the school buildings.
And when it comes to the vaccine, of course, right now, adolescents under 18 still not taking the vaccine because of research. Is there a progression timeline update on a vaccine that could be safe for children and teens to use?
So Pfizer and Moderna are both working through clinical trials right now with kids down to age 12. So that's super encouraging. And I would expect, between now and midsummer for them to ask for the emergency use authorization or fold in kids 12 and under. They might even dip down into kids, maybe 10 and over, depending on kind of what the data looks like. But really right now they're focusing on the safety of the vaccine and do they need a different dose than we do as adults, full-grown adults.
So when it comes to children, when it comes to adults, and when it comes to these vaccines, the more doses we get, of course, the more we'll be able to expand. Part of that is pharmacies, and their ability to be able to distribute the vaccines. Talk about how that process works to make sure pharmacies are adequately equipped and adequately knowledgeable to be able to get the vaccine in the arms of people.
Right. So the Federal Pharmaceutical Company program is sending the pharmacies the vaccine. Right now, I mean, pharmacies do need to be equipped. They need to be able to store this properly. They do need to be able to have a system in place so that they are registering people, getting them in. But then the flip side of it is, and this is a side that we don't see, is that you're then responsible for updating the state and federal health departments about, who was vaccinated. We need demographic information so that we know that we're kind of getting to everyone and that it's fair and equitable. So there's a lot of work. So pharmacies that want to vaccinate people, that's amazing, but they do need to have a lot of things in play in order to actually make that happen. It's not just, can somebody jab it in somebody's arm?
And of course that means educating staff as well. I mean, clearly pharmacies have staff already, but there'll be more staff that needs added to be able to make sure the vaccines work. I mean, do you see that playing out sufficiently when it comes to our local pharmacies? Do you feel like the county, the hospitals will be able to educate staff quickly and efficiently?
Yeah, I think so. I mean, I think the easiest part is how to jab it into somebody's arm. That's that's the simple part of it. There is a lot of regulations and responsibilities in terms of reporting and everything. And again, we want to make sure that pharmacies are able to do what the LECOM people are doing today. Right. You need to be prepared for all of the questions. You need to know those CDC guidelines for clinicians administering the vaccine inside out, upside down, and you need to be able to educate people that walk in, because when they walk in and are thinking about getting that vaccine, they might have that one lingering question that they really need an answer to, and we all need to be patient and answer those questions.
Because it takes a village, like you said.
It does take a village. And we also want people to take the vaccine and feel confident in the process, feel like they had the autonomy to make that decision themselves, and then that they're, making that decision and doing it for themselves and the community. And we want to empower people through that.
Makes a lot of sense. 20 minutes left to go on the call-in here, 814-454-5201, extension 1. Experts on the phone until 7 p.m. tonight. Dr. Dawson was there before then. She said the phones were ringing off the hook. I believe her. We've been checking in. I haven't seen anybody without a phone over the course of 3 hours. And this is the second time we've done this. So, again, so many people with so many questions. And it just goes to show that this vaccine process is still in the very beginning stages, although there is some progress being made with Johnson & Johnson vaccine potentially coming out on Friday. Susanna has a quick question here. Can I get the vaccine if I have liver disease?
Yes. So really the only people that can't get the vaccine, one, if you're getting Pfizer, you can be 16 and older, Moderna 18 and older. They don't want you to get it if you're allergic to anything in that vial. So you should check the ingredients if you have allergies. But if you have liver disease, I really think that this is a moment where advocate for yourself. Go to your physician who treats you for that and say, hey, I need the vaccine. I want it. I just want to double check with you before I sign up for my appointment that it is right given all of my conditions.
We were talking about the last time we spoke together about the importance of primary care physicians and keeping in contact. Would you say that's still a big factor?
Yeah, I think it's a huge factor right now. Having someone that knows you, knows your health situation, and can help you weigh the costs and benefits of any health decision. It's not just COVID and the COVID vaccine. It's any health decision. I think is really important because this is not easy stuff to understand all the different factors that go into this risk, cost benefit analysis of should I get the vaccine or not.
Yeah.
But most of it should be getting it. There's really few people that shouldn't be.
I want to ask you, I'm trying to remember my place of thought here. We were talking about the potential of who should be getting it, who shouldn't be getting it. The concern I think that people have been bringing in addition to the potential side effects, is in addition to the fact that it may not have taken as long as they thought, is just the fact that, well, if the chances of fatality are so low, why do I need to take the vaccine? I mean, we've seen in previous pandemics, epidemics, that a virus has, of course, shot up with deaths and cases and then gradually dropped off. Historically, can you name any viruses, diseases, pandemics that a vaccine was not readily available and it ended up going back to an upturn? If you
polio is the easiest one. Yeah. I think that, for people who can remember polio, if you haven't, I have a really good book recommendation for you. But polio, we saw surges every summer among kids, elementary school kids. And again, it is actually, of any kid that's exposed to the polio virus, it's 99% will be asymptomatic. Of the 1% that is symptomatic, it's a proportion of that percent that actually would get the paralytic polio. So, fractions, it's nothing compared to the death of COVID, right? It's such a small, minuscule thing. But yet polio was this huge deal. Parents dreaded it, feared it. My grandmother was actually a secretary at a school, and she hated an elementary school. She said the worst times to be in that position was getting the phone calls the first week of school about the kids that would not be returning to school because they were hospitalized in an iron lung. For her, it was this emotional story to tell all of us. But that's what happened with polio. And then we get a vaccine, and people didn't even have a choice because ethics were a little bit different in the 50s. But you lined your kids up and you got them those shots because the fear of polio coming again and being cyclical and not knowing why kid A ended up in an iron lung, kid B was at the same swimming pool party, shared the same drinks, did all that, and has no health effects, we have no way of knowing. And it's the same thing with COVID, right? You technically are at very low risk of death, severe symptoms, but it doesn't mean that on an individual level you won't experience those things or the long-term health effects, myself included, right? But we don't know, and why you might experience severe health consequences and somebody else your age who had the same exposure might not have any symptoms. We still haven't figured that out yet. And so that's the reason why it's so important for everyone to get the vaccine, because we still haven't figured out so much. And the vaccine protects you. For me, it seems like such a simple equation, but I know that it's not that simple for some people.
Is that the driving force to name a global pandemic, is just the fact that you don't know why it's affecting other people in a different way compared to yourself?
That's one of the reasons. And I think that this pandemic it's been like the worst case scenario from the beginning, right? Airborne, asymptomatic spread. I mean, it affects everyone. Symptoms are they're fuzzy, right? Like some people have these symptoms, some people have those symptoms. They mimic a lot of other things, so we can't tell, is it flu? Is it a regular cold? Is it COVID? But I think the other thing is we haven't been able to figure out like viral load, like how much virus do you need to have to get sick? How much do I need to have? How much will I be shedding? I mean, all of those questions are still unanswered, which is kind of crazy given that we know so much about the disease, but we haven't been able to lock those things down.
Looking at the future of the virus itself, we would hope that eventually every American would be vaccinated, every person would be able to go back to quote-unquote normal life. But is this something we're still going to have to revisit year after year? People are wondering, is this going to be a virus like the flu? That, we talk about prevention every single year, we encourage flu shots. Do you see it taking kind of the same track as the flu?
I do, yeah. It would be otherworldly, right? If it just kind of disappeared, right? Kind of vanished or, left the human species in general. But I do think that our lives moving forward are going to be about COVID. And, there, again, just like with the flu, there could be years where we see huge spikes, where we see different variants, where we have to, booster shot people with vaccines. But I think it's going to be part of our conversation moving forward.
Yeah, it's part of the conversation. It is the conversation, right?
It is the conversation.
Who am I kidding? There's nothing else to talk about in the world besides COVID-19, it seems like at this point.
Oh my goodness.
Dr. Dawson, we just talked about moving forward what this virus will look like. I think, though, people are more interested about the timetable of this year. Last year was about trying to figure out the virus, trying to figure out the symptoms, what it would do, what the death rate is, what the percent positivity, how we go about mitigating it. This year is now all about the vaccine. Is it possible, just from your thoughts, that early on from what you're seeing, there could be a 2022 in that the vaccine may not be distributed to everybody by the end of this year?
I think that things are looking good with vaccine distribution. I think that the Biden administration is really like, giddy up, let's go. We need to really think about production. I think that, we have not just Johnson & Johnson, but there are a couple other vaccines that the companies are wrapping up trials, and there might be even more vaccine available. So I'm hopeful that everyone will have a chance to get the vaccine this year. That kind of feels good to me. I think that, kind of the period as we're entering the vaccine period, I think the next period for me is like this creative adaptation thing. Our worlds are never going to be the same. Like, this has changed all of us in so many ways, but I think that we are going to have to rethink how things are done in the future, even if it's just to the point of like, I shouldn't go to work while I'm sick, which I'm the worst person. I admit this freely. I've gone with pneumonia. But I think that we really do need to think about how we invest in our own individual health, how we invest in our community's health, how that is a continuum between all of us. But I think we're really entering a phase of creativity and adapting to living through a pandemic.
Is it specifically going to be herd immunity in which we can start bringing things back to normal, or are there other factors that we can hit where, let's say it's a checklist of 10 things and we hit 7 of them, we can start going back to normal? What does going back to normal require?
Ooh. So I think a little bit of luck. So the variants are going to that's going to be a challenge. I've been talking about it as a race. Like, the virus is out in front and we're just playing catch up as it's spinning and changing and mutating and, becoming different variants kind of right before our eyes as we're trying to catch up to it. Yeah. In terms of the community, we're going to need to see numbers go way down again. I think we're going to have to think about those spaces where people congregate and think about, okay, how do we, ensure that we're not, blowing virus across a room if somebody's asymptomatic. So again, I think it's going to be about creativity and adapting, not expecting we're going to flip a switch and everything's going to be normal.
And of course, we know that normal is not something that is coming easily to us right now. It is 6:50 here on our Erie News Now Facebook Alert Desk Q&A session in our phone room. The lines are open for 10 more minutes. if you have a question, we encourage you ask it. Don't feel ashamed, afraid, scared, worried. Every question is a good question because there are still a lot of answers left out there to be sought after. And so if you call this number, please ask your questions until 7 o'clock, and we'll cover them for you. That number is 814-454-5201. Dial the extension 1, and you will be directed immediately to an expert from LeCom Health. They'll answer your question for you, maybe even get you signed up for a vaccine, as Dr. Becky Dawson has done. She says with 15 people. You talk about a superwoman. This epidemiologist has gone in for the phone calls. She's been signing up people for the vaccines. Then she runs down here and answers questions for us. I'll tell you what, I'm not in the medical field, but if I was, I feel like I'd be boat raced right now because this is, I mean, again, the expertise that we have on these panels, and we hope it's been informative for you, has been second to none. And again, we don't know all of the answers when it comes to Erie, Crawford, Warren County, but what we do know is that the distribution is starting and maybe picking up the pace. And Dr. Dawson, we'll end on a couple of things here. For the near future, we've asked all our panelists this. There seems to be at least a little bit of positive light in the tunnel in the fact that we could see Johnson & Johnson, we could see distribution moving forward. What do people need to know, first, for people who are eligible for the vaccine, and second, for people who maybe are on the cusp but aren't quite in that category yet?
So I think what everyone needs to know is that the vaccines are safe and effective. Bottom line is that we all need to get them. Yeah. So if you're eligible right now, it is a little bit about patience, and it is a lot about perseverance. So again, I think, whether you call or whether you do it online or through an app, the one thing I would say is if you are eligible right now and you're struggling, ask for help. So whether it's a call-in line, your next door neighbor, the high school kid that lives across the street, ask for help. I mean, as I said, I've registered a lot of people because I have an email address. Yeah. And, I keep using it over and over again, but it allows me to help people who don't have an email address to get registered. So ask for help. This isn't or shouldn't be, all for one, it's all for one, one for all, right? Like we all need to be helping each other in this moment. So I think ask for help if you're struggling.
Do you have an idea for when the supply will outweigh the demand?
No, I don't. I wish I did. I mean, that's like a crystal ball moment. I think that, there's encouraging news. I think that this past week was kind of blundered by like crazy weather and like hiccups in systems, like everything kind of like crashed down this week and it was hard. So I'm hopeful that, the worst is behind us and, things will start to pick up. And that, if we get the Johnson & Johnson vaccine, one dose, it will, kind of double the number of people that can get vaccinated.
Last question, paint the landscape for our viewers here. Assuming the Johnson & Johnson vaccine is approved on Friday and we move into the month of March, what's vaccine distribution going to look like then compared to what it is like now? Well,
I think that, first of all, the logistics, we're going to have to iron them out because there's a lot of people waiting for second dose. There's a lot of people who are kind of in line, and the first dose is promised of Pfizer and Moderna. And now we have this new vaccine that has a different process going on. Right. So I think that there's going to be a little bit it's not going to be this beautiful smooth rollout because the supply is so big. But I think that, by maybe April 1st, mid-April, we're really going to start maybe see some smooth sailing opportunities to get vaccinated, maybe in large clinics, large facilities, and as the weather warms up, we might be able to do it outside and, I don't know, stand at the fairgrounds together, wait for our jab.
It's amazing. If you said that a year and a half ago, you'd have looked at us with four eyes. But listen, we hope those projections come through because, again, the vaccine, key gateway to stopping the virus, and right now it's just a matter of, like you said, demand and supply.
It is. It's an economic problem, right? It's not a health. It's not a research. Right now, it's just logistics.
Dr. Becky Dawson, as always, we sincerely and more than that appreciate your expertise. A lot of questions, hopefully a lot of answers given out tonight. First of all, thanks for the phone lines. Thanks, and then thanks for coming on here. And we know we'll be talking to you more in the near future because this vaccine question and answer extravaganza, it's not going to end, folks. I know we're going to be done tonight, but it just continues along. Again, if you have a question, even if it's not tonight, please call, email, text our newsroom. We'll be here, and we'll have Dr. Dawson, of course, to talk about all things vaccine. Again, thank you. Get some rest because I'm sure we'll see you probably tomorrow, right?
Great. Have a good evening.
All right. That is Dr. Becky Dawson, epidemiologist, professor at Allegheny College, and an exclusive Erie News Now contributor, rounding out our coverage here on this Tuesday night. There are still 5 minutes left to go in this call-in here in our question and answer phone room. If you have not asked a question yet, this is the time to do it. You have 5 minutes. 814-454-5201, the number to dial. You'll be prompted for an extension. Just press 1, and you'll be directed to one of our experts who will be answering questions for the next 300 seconds or so. Please do so. We thank you for tuning into our vaccine coverage today. Another great way to spread the word and spread the knowledge about the vaccine in the Erie County and surrounding regional area. We have more throughout our coverage here tonight, tomorrow, and this week on Erie News Now. Until that time, everybody, stay safe, stay healthy, and make sure to continue to get your information